Hi all, welcome back to Nursing Guru. Already people are waiting for our live sessions. As we all announced, you guys are going to write an examination tomorrow, that is microbiology, applied microbiology and infection control for third semester BSc nursing students. Okay, so that and all we know that even though, so today we are mainly focusing on the important questions and syllabus review. Entire revision you can do within 1 hour, and as well as we are stressing the things which is related to the important questions what we are going to expect tomorrow examination. Okay, and the question paper pattern, answer writing skills, and the main biggest update of this live session is that is general instruction which is related to your answer booklet that is given by the RGHS University as a new booklet. Okay, so for that booklet, what are the things you have to follow? You should follow. Already whole are written today examination, so they have got already the proper information and instructions by the invigilators. Even though why we are stressing this particular topic means you should not do any kind of mistake while doing this one, and as well as that doesn't makes you to be panic in the examination hall. Okay, so that is the reason. Here we are with myself Swarnashri, and this is Harshita ma'am. So today we are going to give a class which is related to the applied
microbiology and infection control.
Yeah,
before starting our today's subjects, let us give general instructions which is related to your blue book, means the booklet which you are using in your RGHS examination. So those who have written the exams, today's exam, they already know the general instructions. So this is just an intro about this booklet we are giving.
Yeah, so the general instruction is all about the new booklet is that here we have given. I will read it. Okay, once you just glance the things and you come to understand what it is there. The answer must be legibly written using the black ink ball pen. This and all we have already told so many times. Okay, ma'am also in the yesterday class she told use only black ball pen. Okay, so for writing the for drawing the diagram also you should use the black ball pen, should not use any color pens. Okay, the next one, the answer should begin on fresh page. At the end of the each answer, draw a horizontal line using a pencil only. Okay, so you have to use the fresh page for writing a new question. Okay, so for the first question you finish at the fourth page. Okay, so the next question should not be continue from the half of the fourth page, it should be always start from the fifth page. Okay, hope you understood. The next
write answer on both side of all the pages. Obviously you have to write page wise. Okay, the front and back side you can use it. Don't leave the pages one page like one sheet you have written, the next sheet you should leave, not like that. Okay, whenever you are started writing answers, it must be continue page, each page you have to write, don't skip any pages.
Same like our nursing language, we can tell anteriorly, posteriorly you have to write. Right. Okay,
yes. The main answer book has 56 pages. Yeah, obviously for your 75 marks, if you are having a single subject like applied microbiology and infection control and all, you will be getting 28 pages booklet. So that is 2 booklets you will get it. So when you comes to the adult health nursing, you will be getting a 58 pages of booklet, a single booklet you will get it. If you find either less or more number of pages in the answer book, kindly inform the room superintendent. Please exchange the answer booklet if you need any discrepancy. Okay, so here what you have to do means, when you got the booklet, it's your first responsibility to check it whether you have 56 pages or 28 pages or not. All the pages are it's there or not, you have to check it. And if there are any kind of damages or the tier of pages, you should inform the invigilator or the RS immediately. Okay,
yeah. The next one is that do not leave any pages unused in between the answers. Okay, should not going to be leave any pages. The next one, do not tear off any pages from the main answer book. Don't do any extraordinary things after going to your examination hall. Just keep and calm your brain and yourself and sit down. Okay, so should not go into tear any pages.
Next, put into mark or the X mark across the unused or the blank pages in the answer book. Compulsorily you have to do what you have to do, in the sense there is a empty page that you don't want to answer it. So for that empty page you have to strike out.
Yeah.
Okay, you have to put the Strike
So,
mark.
like this. Okay, so like this you have to do it. Okay, why? Because if it is empty, you are not supposed to write anything. Okay, so that, because that is not going to be evaluate. Okay, so you have to do like this.
And next is candidate should be hand over their answer script to the invigilator personally before leaving the examination hall. This you have to keep it in your mind. Sometimes this has happened. So that is the reason. So whenever after completion of your examination, you should hand over that booklets to your invigilator. Obviously they will collect it. So you must be aware of that. You have to give it them written back. Okay. Then the candidate should write page number of the questions answered in a part 7 of the page 2 of page 2 of the answer booklet. So this yesterday also we gave the instructions regarding this. So what you are going to do in the sense, there will be a part part 7. Okay, so in the part 7,
this is a part 7.
So here you have to write the pages of your answer. For example, this is the question number 1. So here the question number 1 is like you have written, that is around 15 marks or 10 marks question you have got. So what you are going to write means the page number from 1 to 6. 6 pages of answer you have written. Here you can see this part 7. Next.
Wait, 1 minute. ಬರ್ತದೆ ಇಲ್ಲ ಪೆನ್ ಇದನ್ನ ತಗೋತೀನಿ ಮೇಡಮ್.
So here 1 to 6 pages of answer you have written. Then second question, you come to the second question. Then continuation number, the page number will be continued up to 56. Then you have to start 7 to 14 pages you have written, means 14. Okay, 7 to 14. Then again from 15 to around 19 page, 19 3 sheets you have written, or the 4 sheets. Then 20, 22. So like this, the whatever you have written, the page number, that you should mention in this part 7. That is very important. You keep it in your mind. Okay.
So don't be confused about this part 7. Nothing, my dear students. Only the thing you have to know that be clarified with your answer writing. Okay.
That's all.
So how many pages you have attended for the first question is enough. Okay. Don't be blank. Don't be panic about this part 7. This is very easy, and our students are very intelligent. They will definitely do it. Okay. So the next select. Next.
For example, if candidate has a question number 1 across page 1 to 5, please record it as 1 to 05. Okay. Next question, if the candidate has written question number 1 in the page of 45, please record it as a page 45. For example, the students, they will do like the continuous series you will get. Okay, this is the page number 1 and this will be the page number 1, 2, 3, like this you will be getting. So what you will do, you don't know the first question answer. Okay, sometimes you will be starting with the third question. So in that case, what you have to do means, here in the third question you have to write, this is the first page. So in this you have to write what? First to 4 pages. Okay, this first question you have written in the fifth page. In that case, what you will be doing? 5th to 10 pages. Okay, like this you have to mention. See, the simple thing is, question number 1, where you wanted to write, you just write it, but you should mention the page number. That is very, very important.
So hope everything you have understood. Okay, so whichever the question you want to attend first, you can attend. Okay, but write it down or note it down the necessarily the page numbers. Okay, so that you have to record it over here. Next one, write a NA for the questions that are not answered. Okay, so which means the not allowed or not answered, like that we can consider NA.
See, for example, you have this 19th question number. Okay, 19th question number, you don't know the answer. Write it, it is not answered. NA, that is enough. No need to give expansion of that. Just write NA.
Don't
that is
write
enough.
like I am not knowing this answer. That is why
that
madam or
no
sir
needed.
I have not written. Should not write like that.
Just you have to mention NK.
Whatever the
That is
doubts you
enough.
have in your brain, you just do one thing, you can able to chat it out in the live chat box. Okay, so you chat, hi, somebody is telling Ashwini Krishna, hi, Shreya Babu Raj, hi dear. Hope you guys are studying properly, already studied, revision you people are making. The next thing, please tell me.
Okay, next is except for MCQ, all questions to be written in a fresh pages. Okay, see this MCQs, you will be having a 12 questions. So keep it in your mind that 12 questions also you can write it in a single sheet. Okay, except MCQ. Okay, you can start other questions in a fresh page. See, you have written, for example, 8th number question here. Okay, the question number 8 you have written in this first page. Okay, so what you have to do, your answers is covered up to here. Don't write the question number 9 here, or another question don't write in the below of this question. Start your answer with the fresh page. Okay, except MCQs you can write like 11, 12, 13, you can write the option and with the answer. Okay, next is, it is mandatory to fill part 7 after completing the exams and before handling over the answer booklet. So you have the idea. Okay, now you got how to fill it. So it is compulsory, it is mandatory to fill this part 7 before handling it your booklet to your invigilator. Okay, you have to fill it. It is compulsory.
The next one is that students are instructed not to tamper or overwrite the barcodes printed on the booklet. Okay, so here we have the barcode. Okay, so in the top of your, you can see that. You take down there.
Here.
So this is the barcode which is there. So same like that in each and every page we have the barcode. Okay, so some people, they are not knowing the answer, they will do the extraordinary things like this and all. Okay, so should not tamper any kind of things, or tearing of the barcodes should not do, otherwise your paper is not going to be scanned. Okay, so that is why should not do this kind of things. Okay, hope you understood. Select. Next one is that invigilators are instructed to strike off the empty pages, and room superintendent must ensure that it is done by the invigilator. Alternatively, students may be instructed to strike off the empty pages, and invigilator and room superintendent must be ensure it. Okay, so
You
that
have to
is the
strike out it.
invigilator part, and they will instruct you guys also, because every student's pages they can't able to strike it out. Okay, so for
They'll
that
instruct you to strike it out. You have to do it.
so these are the main general instructions you to follow. Okay, so that is what we have explained. Hope you guys are understood for the tomorrow examination. So we will continue with our important question series right now. Okay, so
keep it in your mind. This instructions will be if you are getting a new booklet, not for the old booklet.
Okay,
that you have to keep it in your mind.
No. Still now we are getting both of the kind of booklets, no? Old
yes.
and new. One second.
Okay, now we will start with our subject, that is applied microbiology and infection control. Okay, the first part we will discuss about the applied microbiology. So later we will go with the infection control. Okay, so the first thing we will discuss about the most important questions or the most expected questions. So we will start from the unit 1, introduction to microbiology. You can take it down, it is very important. So the important questions we will give first, after that we will start with the syllabus review. First you take down the important questions. It is most predicted questions. So the first question, unit number 1, it is introduction to microbiology. So in the introduction to microbiology, the first question is define microbiology, explain the scope and importance of microbiology in nursing, in the field of nursing. Okay, so they can either ask just define microbiology, and another question will be like explain the scope and importance of microbiology in the field of nursing or
See,
in the
my dear
nursing
students,
practice.
we can't able to write it down all the questions right on our board. Okay, so already we have given in the Instagram reel also. I had given that microbiology important questions. Even more, now we will tell. No, please keep with you one notebook. Okay, so then take it down. Okay, so what madam told the first question?
Define microbiology, explain the scope and importance of microbiology in nursing.
Okay,
So this is the first question in
so
the first
this is
unit.
very important, and as well as you know that this is very easy question also. Okay, so we are expecting either it may be 5 marks from this particular unit. Okay, so in the introduction part will always we are going to know about the subject. Okay, so we are not supposed to go about in
depth.
detail about the particular things which will be there inside the subject. Only the subject terminologies will be there. Okay,
Principal,
so
scope,
principal
like this
scope,
only you'll be
yeah,
getting the questions.
and the history.
Either they can ask only for the 2 marks, just list down the scopes of microbiology or the principles or define microbiology. Like
Yeah.
this also they can ask. We cannot say that how we are framing, like that only you'll get the questions. Either they'll give you in the 5 marks or in the
Yes.
2 marks.
2 marks.
Just we are telling you the concepts, like
How you
they
can
can
get,
also
yeah.
ask like this.
Okay, how you will get the questions, that we are telling. Okay, so okay, so that is what about the first unit. Okay, so importance, they may ask about the importance of microbiology in nursing. That is the most common type of question we are expecting. The next
Next
one,
is
principles and terminologies. From the terminology,
Okay.
one question will come for the 2 marks, or it may be you can expect in the multiple choice questions. Okay, so this is very important. The next one is general characteristics of the microbes. Okay.
Unit number 2. So in the unit number 2, general characteristics of microbes. So the first question, take down, explain the morphology and classification of bacteria. This is very important. Sometimes they'll ask that bacteria cell, growth of bacteria, the phases of growing bacteria, that is also they'll ask. Okay, keep it in your mind. Explain the morphology and classification of bacteria.
See,
Take down the second question, describe bacterial growth curve with diagram. That is what I said, the growth of the bacteria with the curve you have to explain. Okay, that phases of the bacterial growth will be there, that phases you have to explain it. Next, explain staining techniques and their importance.
So explain the staining techniques and their importance. So this is also one of the important question also. Okay, so here you are going to explain all the staining techniques. Okay, so how they are going to identify the bacteria which will be present inside the human body. Okay, so that staining methods will be there, no? So that you have to explain over here. So in the main we are expecting the morphology and classification of the bacteria. Okay, so external morphology means what? External features
Structure.
of the structure of the bacteria. Okay, so that you have to explain here, and the bacterial growth curve. Okay, so that is very important. And one more classification we can expect from this particular unit is that based on their shape and size of the bacteria, so we have to explain the types. Okay, so that is what you are going to explain over here. Okay, so the first classification of the bacteria. After that, motility. Okay, motility, colonization, growth and nutrition of microbes, temperature,
Culture.
moisture, and blood and body fluids. Okay, so these one, and later you can going to be see that
Types of
staining methods. Okay, gram positive bacteria, negative bacteria. Based on the bacteria, we have different types of staining methods. Okay, so that you are going to expect from this unit. Okay, so the third unit. Okay, so we are going to explain you regarding the particular unit also, and we are going with the important question also. Okay, so the next one is
unit number 3, pathogenic organisms.
Yeah.
Take down. So in that the expected questions are write a short note on viruses and their characteristics. Okay, so they may ask for example they'll give a virus name, like take HIV. Okay, explain its characteristics. So for that what you have to do means start from the morphology. Okay, in the intro you will be writing, then after that you have to write the morphology, then after that you should write the general characteristics of that virus. Then diagram is very important, so you have to draw the morphology of that particular virus, what they have asked, like any kind of viruses or the bacteria they may ask in this part. Okay, for that you should write
job creamy. You are asking Are you taking classes, right? So we are taking. So now we are started and we are almost finished the third unit important questions also. You may go through the live session, okay? So now we, madam told lot of questions like write a short note on the virus and their characteristics. Virus are very important, okay? One of the virus you will get, okay? Either HIV, a lot of viruses you will get. So the next one is that explain the modes and transmission of infection. So this is also one of the very important questions. So how it will be transmit, that process they will ask, and differentiate between differentiate bacteria, virus and fungi and the parasites, okay? So two points you can expect, we can expect this question from the 5 marks, okay? So these are very important, must and should you have to study and go. Next one, fourth
Next,
unit.
immunity.
So my dear students, we have only 4 unit in the microbiology, okay? So that I will tell you. The first is that fourth only. So define immunity, explain the types of immunity with the example, active immunity, passive immunity, okay? So that entire continuous topic is there.
Classification you have to write down.
So that full concept you have to explain over here. The next one is describe the antigen antibody reaction. Yesterday also I have told this one, okay? Antigen antibody which will be present in our body. Antigen means germ which will be affecting from the outside. Okay, so this process we will call as a phagocytosis. This is also, you remember, if they are asking about the phagocytosis, you have to, the fight between the antigen antibody, so the reaction we will call as a phagocytosis. This is very important. The next one, explain passive and active immunization, okay? So the immunity you have studied means definitely you will going to answer for this. Write a note on vaccination and cold chain.
This expected for the 2 marks. Short notes they will be asking this questions, vaccine carriers and the vaccines, and also this cold chain. That is very important. Keep it in your mind. You have to study this immunization schedule. Okay, next.
So the next thing is that only 4 unit we have in the which one? This microbiology.
Applied
Okay,
microbiology.
section A, section B. Okay, so
So in the section A, which is includes this applied microbiology. So in the section B, obviously we will get this infection control. Okay. So now we will be starting with this infection control part.
1 second. So section A, microbiology. Okay. So section B is
Infection control.
Okay, so infection control I will write in a short form. Okay, so in this section A we have only 4 units. Okay, so do one thing. Now that 4 units we already, most of the important questions we have given, so that you do one thing, revise. Okay, so now you revise. Okay, so only 4 units is there. Here we have the, again, more than 6 unit we have. Okay, 5 to 6 unit we have. So you leave the infection control. What you want to do in the microbiology is, most of the important questions we already given. Okay, so entire bacteria, virus, that classification, bacterial cell structure. Okay, what we are telling you, are you understanding? No, so take it down. So that fastly you do the revision, complete it of those 4 units. Okay, so now you will finish the microbiology. Next we are going to shift into the this infection control. So there is very easy topics only. We can expect a sterilization, disinfection and nosocomial infection. Regarding
basic
that,
things only which you have studied. That is
our
very
favorite
important
topic, biomedical waste management. Okay, so like this only you are going to get. Okay, so those are the general topics. Okay, so there is nothing much more need of the time to take you to revise those things. Okay, hope you understood this one. Use this strategy. Understood? So again, at the last of the session, few more questions I will tell. Wait for it. Okay, so you have any doubt means comment it down here. Better you take a pen and paper, write it down. Okay, so now we are going to discuss about the infection control and safety.
So in that, take down first one is hospital acquired infection. So they can also ask like, so the section B, it is what?
Infection control.
Infection control. So in this, the first one, it is
hospital acquired infection.
Hospital acquired infection. Okay, so they will not ask in the expansion form. Sometimes they can also ask like this, HAI. Okay, so you have to be keep it in your mind. What is this expansion of this hospital acquired infection?
Yeah.
Next.
So in that particular unit, we are expecting the questions like define HAI. Madam told that. Explain the causes, prevention and control of the hospital acquired infection. So this is also one of the very much important topic, because the entire nosocomial infection, what we will call nosocomial infection, the infection which is caused by the hospital or the outsource of the environment, especially from the hospital medical sector, we are getting any kind of infection or the disease, that is called as the nosocomial infection. Okay,
easily you can understand, it is hospital acquired. Okay, when you stayed in the hospital or when you are being in the medical field, in that time if you got any kind of disease or any kind of conditions, so that we call it as, or any kind of infections, so that we call it as what? Nosocomial infection.
Okay.
So here it's very important, you should know the sources of nosocomial infection, causes of nosocomial infection, then common types of nosocomial infection. For example, you can see that surgical site infection, like this only they will
UTI.
ask. Okay, SSI, what it is? It is surgical site
infection.
Site infection. Okay, then they may also ask this UTI, urinary tract infection. Okay, then
that is also one of the question, urinary tract infection. Okay, then we can expect ventilator associated events. Okay,
like LRTI and URTI, upper respiratory tract infection, then lower respiratory tract infection. So these are the common types of nosocomial infection. This you have to write. So after that you can come to the signs and symptoms part, you have to mention that. Then after that, mode of transmission, how this nosocomial infection, it is transmitted from one person to another person, the transmission you have to write. Then after that you can go with the diagnostic measures, how they have diagnosed nosocomial infection.
After that, you must and should write about the prevention. Okay,
that is very very important, because it is a infection. Okay, so you have to write the prevention for this.
Prevention and preventive measures. You have to list it down, and for the any infection questions. Okay, if they are asking any infectious disease condition or related to the infection, you have to write this preventive measures. Okay, so under that, first next question is finish. Please.
Okay, next we will move on to this isolation, precautions and use of personal protective equipments. So to prevent this, obviously we want.
1 second, ma'am. Before going to that, one more question is there in the hospital acquired infection. So that is discuss CLA BSI, which means what? We have central line associated bloodstream infection. Okay, so that one, needle prick infection and all, needle prick injury we have take means by the time it will happen. The next one, we have SSI, already madam told, no, that infection prevention bundles you have to write it down. Okay, so those are the things you have to must and should study and go. Okay, so they will definitely ask about this one. Okay,
bundles, so you have to study, that is very
bundles,
very important.
Prevention bundles you have
then
to study.
In that also you have to study about the infection control team, and in the infection control committee, who all will be in that committee, who is in charge of that committee, you should know their roles and responsibilities.
Okay, so that you have to write. Okay, so and role of infection control nurse also you can add it in your exam, so answer that will boost up your marks. Okay, so the next one is the second unit from the infection control, so that is isolation precautions
and use of personal protective equipments, that is what we call it as PPE.
All are seeing in the corona time, no, most of the common word, that is
PPE, personal protective equipments. Okay, so in this obviously you know that usage of mask, usage of gloves, then hair cap, this shoe covers. So these are the personal protective equipments which you should know. Okay, you have to explain this is what the preventive measures, and maintaining a social distance from one person to another person. When you're coughing or sneezing, you have to cover your mouth. These are the preventive measures, common measures, you should write it down. Okay, so from this unit you take down the question.
explain standard precautions and transmission based precautions. Okay, so you have to explain about the precautions, what your standard precautions. Okay, so you have to explain about this PPE also and isolation techniques. Okay, so the next one, transmission based precautions, both you have to explain. The second question is that describe the personal protective equipment and its sequence of donning and doffing, means how to wear and how to remove that one, donning and doffing, that you have to, what is the glove procedure, what is the gown procedure, what is how to wear the mask, how to wear the cap, and how to wear the shoe covers and gown. Okay, so and how to remove it, so certain procedure will be there. Hand washing also. Okay, so everything
Next
you
will
have
come to
to
that.
do. Okay, so you have to explain over that.
Next. So the next unit is third unit, hand hygiene. So hand hygiene is very important. Here only the lot of students they'll get a confusion. See, there are WHO 5 movements. Okay, then steps is different. That you have to keep it in your mind. Okay, the 7 steps are different and 5 movements are different. See, in this 5 movements in the sense when you are going to perform the hand washing, steps in the sense how you are going to perform the hand washing, you should know the difference. Okay, movements are different and steps are different. Movements means when you are going to perform, steps means how you are going to perform hand wash. That is very important. Hand hygiene or the hand wash is the very important preventive measure to prevent this nosocomial or the hospital acquired infection. So from that unit you take down the important questions. Explain WHO 5 movements of hand hygiene. 5 movements of hand hygiene. Next is describe hand washing procedure and importance. That is what we call it as steps. Either you can write it as a procedure,
Yeah,
then or else you can also write it as steps. What is the importance of doing a hand wash? That you have to
better to write the steps
mention.
only. Okay, highlight that steps, 7 steps you put, and one step you just, why? Because I'm telling you, you know, for making a schematic representation, that is very easy. Okay, so the next unit,
Disinfection and sterilization. Take down the next unit.
this is very much important unit. Okay, so you have to know about all the disinfection techniques and as well as the sterilization.
Definitely they will ask you this question for your 15 marks. Either it's for your 5 marks question. Okay,
and 2 marks also they will be asked
they
the
will ask,
difference
yes,
between the disinfection and the
sterilization.
What is
Or
the
else they
difference?
can ask that define sterilization,
define disinfection.
enlist the methods of sterilization. For example, they can also ask like what is autoclave. That is very important question. Autoclave we have to study this.
See, only the difference between the disinfection and the sterilization is that disinfection means 99.9% of germs we can clean. Sterilization means 100% of
Complete
germs,
wash out.
microorganisms we can vanish. Okay,
Complete
so that
wash
is
out
what.
of the microorganisms. So from this unit you take down define sterilization and disinfection and explain the methods of sterilization. What we said now, that is very important. The methods of sterilization, like for example heating or the hot oven method or the autoclave method. So all those methods of sterilization you should know. Next, in that sterilization, the guidelines of disinfection you should know that. Then next is specimen collection and BMW. This is the
Not your dream car, it is biomedical waste management. So this we have sterilization and this disinfection. No, after that we have the specimen collection and biomedical waste management. That's there also. Nurse role will be there. So that is why you should learn this techniques, principles, everything. Okay.
So in the specimen collection, so the principles of specimen collections, what kind of methods or the what is the procedure to collect the specimen, then what are the types of specimens which we will collect from the patient like the sputum or the urine, the blood. So how they'll be collecting, what is the procedure of collecting this, you should write this. Okay, then after the collection, how the handling will be there. Okay, the handling of that sampling is very important. The transportation of that sampling is very important from the patient side to laboratory. That is very important. You have to study that topic also. Then in that biomedical waste management, obviously you know this, in the biomedical waste management you should study about the complete biomedical waste management, that is waste collection, segregation, transportation and management of waste which is generated in the hospital. That is very important, which is generated in the medical field, that you should study. Then in that biomedical waste management, color coding is very important. For example, in the black what we will throw, in the blue what we will be throwing, so that and all you have to study. Then categories, there will be a 10 categories, so the 10 categories also you should study. Then next
we have a unit number
7.
7. Okay, so that is a antibiotic stewardship. Okay, so this is also one of the very important questions. So regarding the antibiotic stewardship only you are going to get the questions. Okay,
Antimicrobial resistance, how that resistance works, so that and all you have to study. Okay, next
safety,
patient safety indicators. Okay, so in that patient safety indicators, obviously you should study about the prevention of fall, prevention from the hazards of the patient. So take down the question, explain the international patient safety goals, so that they can also ask like this. See, you try to learn all those abbreviations. Okay, for that abbreviations you should know the expansion, IPSG. Okay, so what it is in the sense, international patient safety goal. Okay, next question, write a note on needle stick injury management. This you already know this. Don't be get panic. What happens, what is the next procedure, what we have to do after the needle stick injury, that and all you should learn. Next, explain 5 safeties in hospitals. Okay, fire safety in hospitals. Next, discuss patient safety indicators. That is an important question you have to study. Explain prevention of falls in the hospitalized patient. That is what I said, like a usage of sidrels and all we have to mention in that. So study this part. Okay. Then next is, in the international patient safety goals, you have to study about the safe surgeries, about that safe surgeries, like the patient safeties. So this and all you have to study. Then how to reduce the risk of this harm or the hazards, we have to prevent the patient, how we can prevent this. So that and all you have to study about that. Next, in the safety control, I already restored that fire safety is important, laser safety, then radiation safety you have to study. Then hazardous materials. Okay, hazmat we call. Hazardous material. Okay, how we are going to protect our patient from this hazardous materials, that you have to keep it in your mind. Next, employee safety indicators. So in that employee safety indicators, I list down that needle stick injury management. It is you have to study that, and vaccination of that particular employees when they join to their occupation, that they have to vaccination obviously they have to
okay,
get
so
it
and
done.
TT also we have to provide for the employers to save their health. Okay, so that is the thing which is there in that.
Then healthcare worker immunization program, that you have to study. Okay, that is what we said, vaccination of the employees. Okay, healthcare worker immunization program and the management of occupational exposure. So in this you have to study about the vaccination of that particular occupations
And
or the
next one is
employees.
that needle stick injury. Okay, so that is also one of the important
Question that I already listed down. So this is
all
what
about the important questions
which is expected from the microbiology and infection control.
Okay, so far all the units were covered over here. So from first unit again we are not supposed to explain all the things. Okay, so this is not possible to complete all the units right now. Okay, so along with the important questions we have spoken about lot of the questions. Okay, you don't worry about that. Now you take the questions which is related to your tomorrow's exam. Okay, so again we have a few more questions, you just take it down. So based on your all units what we have discussed right now, no, so based on that we have the certain questions. The first question is
Define sterilization, explain method of sterilization and their application. So this is also, we already said that you have to define what is the sterilization, then after the methods of sterilization, each method you have to give a classification, then after that what is the importance, what is the application of this, each methods you have to explain. Okay,
So-
and next is
discuss hospital acquired infections,
either they can also ask like nosocomial infection and their prevention.
Okay,
That is the very important thing. When you got that infection question, you must write the preventive measures.
must and should this concept will come. Okay, so the next one is explain the chain of infection and methods to break the chain.
That is what we call, like we said, that method of mode of transmission,
Transmission.
how the infection it is
Breaking.
transmitting, how that chain we should break,
down.
that you
By
have
doing
to
this isolation and all we used to change the break, no, so that techniques you have to explain over here. The next one, define immunity, explain the types of immunity and immunization. Okay, so immunity complete topic, passive, active. Okay, so that
Natural,
full you have
acquired
to do. Yeah.
Next, discuss biomedical waste management and its importance. So this you already know this. This is a very important question you have to study. Then explain standard precautions and transmission based precautions. So this is also we already listed down. So you just give a quick review of this. Then
describe the morphology, culture, characteristics and disease caused by the bacteria. This is the very important questions that we can expect from the second unit and the first unit. Okay, so there only we are going to study about the basic things, right? Microbiology.
See, they will not ask like just explain about the bacteria. They'll give an example. Okay, so for just take example Salmonella typhi. They'll ask that explain the cultural characteristics of this, morphology of this. So like this only you'll get the questions.
Explain viral infections and their prevention. Okay, so that you already know about the virus. Okay, the shape of the virus that you have to
Viral
cover with
infection
that.
you have to write down.
The next one is
Infection.
explain the role of nurses in infection prevention and control. This is very important. Whatever the question you will get in the infection control to explain the nosocomial infection prevention, means breaking down of the chain and all, write it down the role of nurse. Must and should you write for the 5 marks 10 marks question if they are asking. Then short as a type of question you take, define disinfection,
explain about disinfection, explain about a sterilization, then autoclave method. They can even ask for the 5 marks question. Then hand hygiene, movements and steps or the procedure. Then personal protective equipments, PPE.
List out that and
List out.
donning and doffing
Is also
techniques also
important.
you have to study. And
Next,
one,
biomedical waste management, chain of infection,
define nosocomial infection,
Immunization.
define immunization,
vaccination schedule, that is what universal
the next
immunization schedule you have to study. Then isolation techniques, airborne infections,
bloodborne infections, and next one is universal precautions, hepatitis B infection, HIV infection, that you have to remember the diagram also, you have to draw it over there for the particular question.
Then fungal infections,
parasitic infections, specimen collection and transportation, how you have to collect the specimen, whatever
the transportation or handling of that.
See, in this specimen collection, before and after we have to do the hand hygiene, we have to perform it. Okay, so the techniques and all you have to list it down, the procedure, entire procedure you have to write it down over there. Okay, for this question. Then infection control committee, who all are present in the infection control committee, that you have to explain. Okay, so those are the very important questions. Already we have done the reel on these questions also. If you want, means you can comment it down in the Instagram, or else here also you can comment. Okay, so far we have given the important questions, ma'am. Now we are going to supposed to know about the answer writing.
Okay,
how we can write for the microbiology, what are the steps we need to follow.
And in the introduction part, you have to know the father of microbiology. That is very
Robert
important.
Koch.
Multiple choice question we
MCQ.
can expect. Then you should know the contributions of Louis Pasteur in the microbiology field. Then contribution of Robert Koch in the field of microbiology. That is a very important question. Next.
Next, we are going to see about the answer writing skills. Okay, so anyhow, you are going to do this paper presentation techniques, all the things here also, but only the thing wherever the necessary microbiology also we need to draw the certain diagrams. For example, morphological features of the bacteria they are asking means you have to draw
Cell
down the cell
diagram you have
diagram.
to
Okay,
draw. Then
bacterial
keep
cell.
it in your mind when you are drawing any kind of diagram, don't label it like this. It looks odd. Anyhow, you have drawn the good picture, so draw it like this.
Everything should be in one
In a
side.
one order. Okay, so this gives a more
attraction of your
yes.
answer by the evaluator. Okay.
Next, how you are going to present your answers in the sense, obviously you all
Malayalam
know.
para Malayalam korchu ariyam. So try to understand in
English because you
also.
are going to write your exam in the English.
But we can tell in Malayalam also, no issues. What you want to know in Malayalam, this class.
Tell
Malayalam
to us.
also we can speak, but not that much fluency in Malayalam. Okay, so try to understand in the English.
Okay, next thing is how to present your answer. So just take
see now
question.
Madam is explaining about the how to present the microbiology paper. So in the one and only in the nursing guru only we are telling from each paper whatever the techniques we need to use. Okay, so for each and every subject different techniques we are telling in our channel. Okay, so first one is this.
Okay, you got the first question, that is hospital acquired infection or the nosocomial infection. Explain about this. Okay, what you are going to do means, first you will be writing a heading of this expansion of this hospital, HAI, hospital acquired infection. So after this you have to underline it.
Lakshmi Priya R. Nair is asking about INLT exam important questions Vano examine. So definitely 35 to 38 marks of questions we have seen from our video. Okay, so whatever I have conducted 2 live classes. Okay, one is
Yesterday's
nutrition and dietetics
community.
and another one is community part 2. Okay, 7th semester. Whatever we told that questions only came. Okay, so 10
you can
marks
cross verify with our
15 marks question only from our video.
That is family planning. We said that family planning question only they have got it for the 15 marks.
And 2 marks also they
Yes,
got
2
the
marks.
methods of the family
Even
planning.
what we have said listed down, they have got it in the multiple choice. Easiest questions they have got it for the multiple choice question. Even you can cross verify with your question papers and with our video.
When question paper came, no, that time only we come to know that okay, so in the last year onwards we are giving most important questions only. Don't bother about dear. Okay, so definitely you will get the same questions for the tomorrow exam. Okay, so because whatever the we are stressing the important topics, those are the 100% guarantee topics that they can able to pick the question.
See, already you have studied, you have completed whole syllabus, you have studied the whole syllabus. Now just you are doing a quick review of this. In this particular syllabus, what you have already studied, just we are highlighting some questions.
Okay, so because everything no need to study right, no. So where you need to put the concentration more, that we are stressing out. Okay, Ma'am Para. Okay,
now the question is hospital acquired infection. So in this you have to mention the question number 1. Okay, in the question number 1 you have mentioned that above this you have to mention. Okay, question number 1.
Suppose if they are asking in 1, okay, then you should know.
Then after that it is a hospital acquired infection heading you have mentioned. Then start with the introduction. No need to write 1 page of introduction, that also we already said. Okay, when you are writing an intro, it must be within a
4 to 5
points. That is enough. That you have to write. Then they ask this a definition. So when you are writing the definition, the author specification, it's important. Try to give the author specification. For example, this nosocomial infection, if you wanted to write the definition which is given by the WHO. Okay, write the definition. Below that you can write WHO.
How you are writing, first you will write the definition. Okay, after that side of the definition you are here mentioning that
WHO like that.
here according to
Huh.
WHO. Okay, so this much
That's-
only is enough. Okay, so if you know here, that is well and good. If you don't know, no need to put a wrong here and all. So according to whom it is said. Okay, so that you have mentioned here means that is good for you to score the better marks.
Next is common types of nosocomial infection. Just I am telling you how to present the answer. Okay, just common types of nosocomial infection. So for in the first page you have covered the introduction and the two definitions you have covered it. Still, if you have a page in that first page, if you have the space, you can start with this common types. If you don't have, go with the second page. In the first page only, don't write the schematic presentation, because they'll be feel like you are trying to cover the pages, not the answer. You don't know the answer, just you are covering the pages. They'll think like that. So instead of that, in the second or third page, you started using the schematic presentation. For example, you can use a schematic presentation like types.
You ask Lakshmi Priya, you are from which semester? Da? Can you mention?
Like this. You can use this.
You mean continue.
Okay, you can use the schematic presentations like this, or else you can also use like this. Here one common type, 3, 4. So like this also you can use the schematic presentation. See, this is only just to attract the evaluator's eyes. Okay, not to cover your pages. That you should keep it in your mind. If you are simply see in a one page, full page, this schematic you have drawn in the upside, then second you have drawn this in this below. Just they'll be thinking that you don't know the answers, you don't have answers to write, just you are covering up the pages. Don't do like that. When you have written this common types in the above schematic presentation, below that you should give a expansion of those you have enlisted. This is how you are going to present. See, whenever you have written the lines in that, you felt that okay, WHO given some definition, that is infection which is occurred in the hospital. Now you have to underline what? Infection occurred in the hospital. That word only you have to understand. Means you have to underline. Okay, only the important one. Not all the paragraph you are underlining. Not like that. Just only important points which you feel important, that you should highlight it. That's all.
You are telling da, we also got important questions only came from the live. Okay da. Yes, yesterday in my nutrition also most of the question came da. I have seen the paper. First SEM it is came. Okay, so you can watch it our reel also in Instagram, you will get. So now you continue.
Yeah, that's all how you have to present your answers. Don't try to cover up your pages, or don't write your just list it down, or you just wanted to cover it. Not. You add the important points and write your answers. Don't write all those stories and don't write it in the paragraph. You have to specify with your points. Use the bulletins. Don't write it in a paragraph.
And people are using the bullet, they will do like this. Hey, why you are doing that kind of bullets? That will make sure you to that ink will spread from your hand. Okay, so use
no need, just simple one. Use this arrows or use like this
stars. Okay, so that is enough. So how much you are maintaining the simplicity in your answer writing, so that will
very
more
important.
Attract you. Okay, so that also. And one more thing we have to tell. So most of the questions were going to be finished. Okay, so madam already told about this also. Wherever necessary the classification will come, please kindly use the flow charts. Okay, use the flow charts. And wherever the infection prevention will come, kindly write it on means role of infection control nurse. Okay, so that is very much important you to get a better score in the examination. Okay, so far we have discussed lot of the things which is related to the microbiology and infection control. So once again I would like to speak about the things which is few of the questions what we are left to know that we can give in a very short 2 to 3 minutes, ma'am.
Okay.
So from the first unit we can go.
Okay, we will start from the first unit, that what I said before, the contribution of Louis Pasteur and the contribution of Robert Koch, that is important. You have to study those, and principle of microbiology also it is important. Okay, list down the principles of microbiology you have to study. Then when it comes to the general characteristics of microbes, the whatever the microorganisms is there or the bacteria you are studying, the bacteria cell diagram it is important, labeling is important, then bacteria curve growth also important. That with the schematic means with that phases you have to explain, with that curve you have to explain. Okay, simply if you are writing all those theories, that is no use, just you have to explain with the diagram. Next is when they ask for the bacteria, you have to write it with the intro, characteristics, morphology, diagram you have to draw, then mortality of that bacteria, either it is a gram positive or the gram negative, everything you have to mention. Then the mode of transmission of this particular disease the bacteria it is causing. Okay, that is also you have to mention.
See,
for
while
that, what is
writing
the
about
prevention?
while writing about the bacteria and all, mention about the general morphological structure of the bacteria, features, and their motility, colonization, and the growth and nutrition. Okay, of the microbes, and the
Staining,
temperature.
culture.
Okay, moisture, and blood and body fluids. Okay, so that is all from the second unit. You have to study and you have to get the questions from that. Okay.
Then in that also the very important thing is sources and transmission of infection, that you have to study. Okay, next
And
is in the
one more
immunity.
is there, aerobic and anaerobic. Okay, so that differentiation. Okay, so that you have to study. Next, pure culture techniques. Okay, so that you have to study. Both are very important. Next one.
Next is in the immunity, we already told that definition of immunity, then types of immunity or the classification of immunity you have to study. Then antigen and antibody reaction. Okay, hypersensitivity reaction you should study. Then serological test and the immunoglobulins, that you have to study about that. Then one more thing, it is universal immunization schedule. It's important. And vaccination
Cold chain.
or the vaccine carrier, cold chain. Next is in the infection control and the safety part, there are hospital acquired infection. In that, what are the common, like we already list down that UTI or the SSI. So in that, what is the prevention? For this, you have to
one more
list
is there,
down
antigen antibody reaction. So again and again we are telling that one, that will definitely come. Okay.
Okay. Next is infection control committee and the surveillance and role and responsibilities of those committee or the team you have to mention. Then isolation precaution and PPE in that. So we have told that standard precautions, international precautions for the infections. Then transmission based precautions you have to study. Then one more thing is direct contact and droplet and airborne precautions you have to study. Then in the hand hygiene or hand washing techniques, movements
and
you
all.
have to study. Then
1 second.
principles of sterilization.
It's come up a lot in exams. Here's a crisp, long answer you can use.
Principles of sterilization, types of sterilization, disinfection, between difference between the disinfection and the sterilization, disinfection methods. Then equipment cleaning, that is also you have to study. Then Spalding classifications you have to study. This is also very important topic. Keep it in your mind. Then in the specimen collection, the principles of specimen collection, handling and the transportation, it's important. Then collection techniques. What are the techniques which we use to collect the specimens, handling or the containers and the transportation also it's important. Then in the biomedical waste management, color coding, categories, then segregation, collection, transportation and management of biomedical waste important. Then in the antibiotic antimicrobial resistance you have to study AMR, that is okay, antimicrobial resistance, AMR you have to study that. Then rational antibiotic use you have to study. Then prevention of MRSA and prevention of MDRO you have to study this, MDRO infection and the MRSA infections you have to study this. Then in the safety indicators, the fall safe safety. Then prevention of DVT, that is also important. DVT prevention, deep vein thrombosis prevention in the like the prolonged standing in the prolonged bedridden patients. So you have to prevent, how to prevent this, you have to study. Then prevention of IV fluid when they are doing a canalizations. So what are the complications occur, how to prevent that, that is also how to see. Then blood transfusions safety. Then care of the lines and drains, tubes, whatever they are having or inserted in their bodies, that is also very important thing, you have to study that. Then restraint policy and the patient policy you have to study. Then in the international safety controls, so what we have said, that international patient safety goals, that you have to study.
So
Then
all those things we have finished. Okay, so all the things we have covered. So now you tell me, who are watching, if you have any doubt, please chat with us. If you have any doubt, we will clear it. Okay, so I will give a 2 minutes to chat. Okay, you chat, I can extend my time also. Okay, don't worry about that. We also okay, if you have any doubt, can we wind it up? Or if you have any doubt, please,
we also go to
that is to the questions. Malayalam, please. Malayalam, we know bit only. You ask in Malayalam, I can answer to you. Okay.
If you have any doubts, you
Definitely.
cannot convey in the English, you can convey us with your language, Malayalam or in the Kannada or anything. So we will try to answer for that, give answer for that.
Definitely, da. We know in Malayalam, korachuvara. Full we don't know.
But
that
we
is
will
why.
try
to speak in Malayalam. Don't worry, we will learn. Okay. So yeah. Spunky, who is the Spunky? Ma'am, IPSG. Say, ma'am. This one. See, international patient safety goals. Okay, so that is in the patient safety.
So you wanted to know about the
1 second. Really.
that is international patient safety goal. So in this patient safety goal, what you wanted to learn in the sense, like for example, the correct identification of the patient. Okay, first thing, so when before giving any kind of medicines or before doing any procedures, the identification of that patient is very important. Okay, you have to be aware of that. The first thing is what, in we have a 6 international patient safety goals. Okay, in the first one is identification of patient. So in that identification of patient, you must be know the patient name and the hospital ID, admission ID of the patient. Okay, and then the second one is improve effective communication. So the clear verbal communication you should maintain with the patient, not the non-verbal.
One-to-one communication is very important, and that should be very clear. Okay, so it should not make any consequences between you and the patient. So that is why you have to, whatever you want to communicate, that should be very clear way.
Okay, next is improve the safety of high alert medications. So in this, improve like safety of this high alert medications. For example, higher antibiotics they are getting. So in that time, simply in the NS bottle you are giving medicine to the patient, but they don't know what medicine they are getting. Even the patient attendant, they don't know. So whatever you are giving a medicine, you should label it properly. And storage and handling of those high alert medications, that is very important. Then before giving it, you should double check it with the doctor's prescription. High alert medications, any kind of high alert medications if you are giving, you should verify it. Okay, double check it with the doctor prescription, then you have to give. The fourth one is ensure safety surgery. Okay, verify the whether it is a correct patient, then correct procedure we are doing, whether we took the informed consent from the patient, then whether it is a correct surgical site, that is also very important. Okay, the fifth one is what, ensure safe surgery. So in this, you should know about the correct patient, correct surgical site and correct procedure. that you have to be aware. Then the fifth one is reduce the risk of healthcare associated infection. That is what a hospital acquired infection. How to reduce this, how to prevent this hospital acquired infections. Proper way of maintaining or wearing this PPE and proper maintaining hand hygienes. So following the standard immunization schedules, then this you have to study. Then the last sixth one is reduce the risk of patient harm resulting from the fall. So this is also we have already said, we have to prevent the patient from the fall and the hazmat. Hazmat is nothing but what? Hazardous material. Okay, from this we have to prevent the patient. So if you don't know that, take it down. This is very very important. We have a 6 IPSG, okay, International Patient Safety Goals. So we have total 6, just as I listed down: identification of patient correctly, then improve effective communication, improve the safety of high alert medications, ensure safe surgery, then reduce the risk of healthcare associated infections, reduce the risk of patient harm resulting from the fall.
Okay, you ask about the MCQs. Okay, so whatever we have covered, no, that concepts, from that only MCQ will going to be prick it off. Okay, so we can't able to tell it randomly. This question only will come because MCQs are the objective type of questions that they
is
will be
unpredictable.
based on, yeah.
But the whatever the topics we have covered, in that only definitely they will ask, but we cannot predict each multiple choice question. This only they can ask. It's not like that. Why? Because it is an objective type question. We can predict 10 marks question, 15 marks question, 5 or 2 marks question, not a MCQs. Okay, but whatever the concept we have said to you, that whatever this concepts we have said to you, in that concepts only the multiple choice questions will be covered.
Okay.
So that is the reason you should be thorough with this
all the concepts. Okay, so far we have discussed all the questions, and according to topic based and according to the unit wise we have discussed so far. Hope you guys are revise it and you got all the important questions. All the best for your examination from Nursing Guru team. So we will see you in the next live tomorrow, who are studying for the OBG for them, and as well as we have the live session for second semester nursing foundation. So your juniors and all will be there. For them also you inform to attend the live sessions to get the benefit of it. So because this is a free of cost. Okay, so no need to pay anything for the live. Okay, so free only you are getting the important questions and the revision classes. Okay, so thank you so much. Tomorrow we will meet again.
Thank you all the best.